Good morning, everyone. Welcome to episode 11 of Wake Up with Walters. Today we're going to talk about, is it time for a facelift? So we'll shift gears. We've been talking a lot about some body contouring. So for the next kind of 30 minutes or so, we'll talk about facial rejuvenation and, specifically the question, is it time for a facelift? So grab a cup of coffee. Let's wait for a few people to join, and then we'll start educating. Again, if you guys have any questions, just put them in the comments below. If you have any specific topics that you want us to cover while we're still quarantining, just leave those in the comments. Feel free to DM me and we'll try to cover those topics. Let's wait a few more minutes and we'll get started. Okay, so let's go ahead and get started. Today, again, what I've been doing is really taking some of the educational content on my website. So on my website, under resources, I have multiple blogs. And so, really a good source of information. A lot of questions are answered on different procedures. So, this blog is, I am over 40, is it time for a facelift? And so, anytime someone comes in to my practice for facial rejuvenation, we talk about all options. And I think when we start talking about surgical options, it's around the age 40. Now, not saying that we recommend facelifts for every person in their 40s, but it's something that we start talking about. What we never want to do is overfill a patient with filler and really make them look unnatural. I think that's done a lot in all areas of the world and all areas of the country here. And so I think it's our job as plastic surgeons is to really talk about all options. And the goal is always a natural rejuvenation of the face. Sometimes that just requires neurotoxin like Botox and fillers. Sometimes that requires some minimally invasive options, and then sometimes that really requires some type of surgical rejuvenation like a facelift and neck lift. So, when someone's in their 20s and 30s, as far as, facial rejuvenation, we're really not talking surgery, for facial aging, but at the age of around 40, that's when we start somewhat talking about some of those options. And so, when is the right time for a facelift? Well, that's very personable and very individual. Age is only a number, but I think once we hit 40, that's when we're starting to see some signs typically of aging. And when I tell patients when they come to me for, fillers and really for their first visit sometimes for facial rejuvenation, if you're picking up something in the mirror and you are saying, I want this result, well, that's when we really have to really start talking, the pros and cons of non-surgical, minimally invasive versus surgical results. I think surgery is the only thing that is effectively lifting the jowl area in a predictable manner. It's the only thing that's effectively tightening the neck in a predictable manner. And so, those are things that, again, we start that conversation. Now, patients may not be ready for it, and they just have to understand what we can achieve non-surgically with Botox and fillers. And, I think as long as patients are educated on what we can deliver and what we can't deliver, then I think that leads to greater patient satisfaction and then ultimately greater, surgeon satisfaction. So, age, the main thing is that I think to really kind of get out of this, today is that facelifts aren't just for individuals in their 60s and 70s. And, the best time sometimes to get a facelift is when you're, in your 40s and 50s, because that's when the skin quality and the texture of the skin and, all of the ligaments are tighter than they are when they're in 60 and 70. And so sometimes when we start a little bit earlier with surgical rejuvenation, we can have results that, last 10 years or even more sometimes. So, that's not to say when you're in your 30s and 40s that non-surgical options don't work, because they do. We just have to really, make sure that we're covering all options so that all of our objectives are obtained in a natural way. Individual factors. So let's kind of, that's what we talked about is, age is really just a number, but I think when we hit the 40-year-old mark, we need to start talking about surgery. And so what are some other factors? Well, of course, everyone's individual anatomy is different. People age different. It's multiple factors, genetics, how much they were in the sun and had sun exposure during their younger years. And so, all of those factors do play a role on the aging process. And we know that when someone ages, it's a multifactorial, issue. The skin, so the topical layer of the skin is aging, so we see signs of aging in the skin. We're losing some fat in our face, and a friend of mine just sent me a picture when I was in 2001 when I was in college, and you can see I had fuller cheeks. And now I'm 40 years old, and I can start to see that I'm losing a little bit of fat in my face. And so that's a very common beginning of the signs of aging, is losing fat centrally. And then after that, that's when gravity takes a hold and the skin starts losing its elasticity, and so then things start descending. So instead of having majority of the volume of the face in the upper mid face, things start dropping down, and we start getting volume in our lower face, which that's the reverse of really a youthful face. So anatomy does play a huge role, and certain environmental factors as well. So history, again, that kind of goes with the same thing, is basically, what was your life like? Basically, did you, live on the beach for, your teenage years and 20s and 30s? And did you have a lot of sun exposure? Did you start doing some preventative type stuff in your 20s and 30s? Botox, some fillers, and so, skincare, and all of those things are very important for people to look younger as they start seeing the signs of aging, so in their 40s. If you want to look your youngest in your 40s, you should be doing something in your 20s and 30s to be protective against aging. And, you know, again, number one, in your 20s, that's skincare, that's starting some type of, you know, sunscreen and retinol type product. And then at some point transitioning to neurotoxins and occasional fillers to really try to maintain that youthful look and hopefully, you know, lessen the signs of aging. Elasticity. So again, this is something that is individual and it's based on genetics and really, you know, a lot of individuality for that. But, you know, in your 40s and your 50s, your elasticity is a lot better than in your 60s and 70s. And so, you know, we kind of have a saying, if you needed a facelift in your 40s or 50s, but you're waiting until you're 70, it's a lot harder to get that striking result that we could have gotten in your 40s and your 50s. So it's just something to start thinking about. Is, you know, in our 40s, we still have that elasticity in the facial skin, and, you know, when we go to tighten it, then everything that we're doing is holding up a little bit better. And so I think, you know, women in their 40s and 50s really get that crisp jawline, they get the tight neck, you know, with surgical intervention. And so another thing is to just talk about recovery. So, you know, obviously when you're in your 40s or your 50s, you're usually healthier than when you're in your 60s and 70s. And so, you know, as you develop comorbidities, you know, diabetes or high blood pressure and things like that, then, you know, your recovery is going to be a little bit more challenging compared to when you're healthier in your 40s and your 50s. So, you know, it's one thing to consider. And, you know, being younger and healthy, that directly affects your recovery time and the positivity of your results. So it's something that we, you know, really kind of start, again, discussing, you know, when people come see us in their 40s and 50s. But again, no two people in their 40s are the same, and their own level of satisfaction on how they're aging isn't the same. So that's why we talk about options. And so, you know, obviously sometimes the first time someone's coming to see me for facial rejuvenation and they're 40 years old and they haven't had anything done, then, you know, usually the first step is not going to be straight to a facelift. We're going to talk about, you know, all the signs of facial aging. We are going to talk about options. And then, you know, we're usually going to start off a little bit slow, you know, Botox, fillers, and then kind of work up to what we're going to do. But the main thing is to really, you know, tell patients options and really try to get their expectations out of the procedures that they're choosing. So to make sure that we're not just overinflating and making patients look, you know, too inflated and almost, you know, not human-like that we see sometimes on the TV and celebrities and whatnot. All right, we're gonna go through some pictures. Let's see if there's any questions. You know, how many incisions are typically required? You know, it's one real main incision, and it really goes kind of, you know, underneath the sideburn, right in front of the ear, around the earlobe, behind the ear, and then back into the hairline. And that sounds a little scary, but we're going to show you some pictures. The facial incisions heal very easy, and so and very well. And so what I tell patients is that, you know, it usually takes about, you know, 3 to 4 weeks for most of the swelling to go away to where you can kind of maybe go in public and be around people that you know. And then, you know, really about 6 to 8 weeks to go in public around people you don't know, and for them not to think anything, you know, really strange has happened. I think that's when most of the swelling has gone. But I tell patients, if you're trying to take pictures for a wedding and whatnot, then usually it's about 3 months, and because we just really want all of that swelling to undergo. Most facelift procedures that we do, we also, again, in order to get a natural result, we're utilizing fat transfer. So, we're filling centrally with fat, the same places that we would usually fill with filler, and then we're lifting laterally and tightening the neck centrally. So, those are kind of the general rules. And, it takes about 6 to 8 weeks for you to be around people that you don't know and for them to not notice too much things. But pictures for weddings, you just want to make sure the scar is healing great and for nothing, for that not to be noticeable. And I usually tell patients to try to do that for about 3 months. Okay, so let's look at, some photos. So you can see this lady, she is obviously above 40, but we can still get a stunning result. And the goal is really just to not change who she is. It's not to change what she looks like. It's to rejuvenate her. And, it's to turn back the clock, hopefully about 10 years or so. And so what we did for her was, we did fat transfer to her face, and then, facelift. And so we've tightened laterally, tightened a little bit centrally to give her a nice neckline. And you can see that, it still looks like her. It just looks like a more youthful version of herself. And you can see the same thing there. And, if you look closely, you can see some evidence of redness of the scar around the ear, but healing very well. And so, if she went into public at this point, no one would really kind of notice that she had, a surgical intervention. And you can see her hair's pulled back and, looking very natural. Same thing here, just looking at really kind of the cheeks kind of filled, jawline tightened, not overly tightened. You don't want to make someone in their 50s or 60s almost look like they're in their 20s. I think that's when it's overly done. It can look, just not appropriate for her age. But, this is what's accomplished with surgical facial rejuvenation. To affect the jawline and the neck, it's very hard to do any of that non-surgically. So, that's just something to keep in mind. Again, just more views. Let's go on to another patient. Okay, so another patient, again, just really looking tired in her pre-op photo on the left, exhibiting all the signs of aging, some loss of facial volume in her cheeks and in the central face, some descent in the lower face and loosening laterally. And so the only thing is that's really going to restore all of those components of the face in a natural way is a facelift in combination with fat transfer. So those are things that we talk about. Now, if she came and saw me in the first appointment, maybe she doesn't want surgery. So we would talk about some, fillers, but, non-surgical intervention for a patient in this age group, there's only so much that we can do. And you have to be very careful that you don't overfill patients in their 50s and 60s and make them look really just not natural. So, for this lady, we talked about surgical rejuvenation. You can see it, and that's the other thing is when patients smile, you want to make sure that they, whether you do filler or whether you do surgical intervention, you have to make sure it looks good in all angles. And that means in a dynamic position. So with smiles, you want to make sure that there's no creases when they smile and that it looks, still looks like them. And so, that's all, and that's the major problem that I have with some minimally invasive treatments for the neck and for the lower face is because you are applying this energy and then you're just hoping that this energy does something to the deep layers of the face, and you hope that it heals predictably. And I think more often than not, you get a result that's not that impressive, and patients paid a lot of money, and then you created a lot of scar tissue underneath the skin that makes surgical intervention that much more difficult later down the road. And so, there's a lot of things like what we talked about. There's the fat that you're losing, the muscle is getting loose, the skin's getting loose, and the gold standard to reestablish all of those layers of the face in a natural, elegant way is a surgical facelift. Again, just looking at her cheeks, looking at her jawline, looking at her neck, notice looking at her ears, you don't see the scar, and everything like that. Again, another view, looking at the cheek, looking at around the mouth, the corner of the mouth, the jawline, the neck, and the incision pattern. She has an incision that runs, right underneath the sideburn and in front of the ear, but they heal very, very well. Now, let's look at some just other non-surgical stuff. This patient is in her late 30s. And so this is where sometimes we start talking about, surgery and surgical tightening. But, obviously a patient like this is not ready. And I wouldn't talk her into a facelift at this point. And so what we talk about is just doing some type of laser liposuction to the neck, trying to get a little bit of skin tightening. And you can see with that, even her jawline looks a little bit more tightened. But you can see that there still is a little bit of jowling, and really the only thing effective to truly lift that in a predictable manner is a surgical lifting. However, she's just not ready at this point. Let's go to this one. Here's another patient, again, approaching late 30s, early 40s, and really has done remarkably with her aging on the left side. She doesn't look that old, but this is where we start talking about non-surgical intervention, and then as well as what are the limits of non-surgical intervention. And so for her, we did combination of Botox and fillers, and some jawline sculpting with some Botox to the masseter and some filler. And so we can accomplish really stunning results non-surgically, but at some point there's a limit to that. And that's where, like in those other patients, we start talking about surgical intervention. Okay, so I hope that helps a little bit. If anyone has some questions, we can spend a few minutes answering some questions. It's up to you guys. I can talk about this all day. So, I've reserved some of these hours during this quarantine time to really kind of open it up to my followers and open it up to, education, to really kind of get, more education out there and have better, have patients better informed. Is there another option to place the scar behind the ear? If you're doing a facelift, then not really. I mean, there's some short scar facelifts, but the gold standard is to place the incision right around the sideburn and then in front of the ear, in the natural creases around the earlobe and then back into the hairline. And if done, in an expert fashion, then again, at 1 month, 2 months, 3 months, you can barely tell the incision. So that's one of, the incisions on the body that just heals remarkably. And, it really does. We very rarely have problems with poor scarring. Sometimes if the skin is tightened too much, and so we don't want to put any attention on the skin. And that was the problem with some types of facelifts that used to be advertised on TV. Most of those were just skin tightening procedures. And so then you saw some problems with some scarring, and that it would pull the ear down as it relaxed because there was too much tension. And so all the tension for a facelift is on the deep layers. So it's like a deep plane tightening procedure. Is there too late for a facelift? No, I think just depending on your overall, expectations. So I think at any age we can deliver some type of tightening, but patients who are in their 80s and have a lot of loose neck skin, the elasticity of the skin is just not as good as when they were in their 50s. And so when we tend to tighten patients who are in their 70s and 80s, then during that healing phase they do kind of loosen up a little bit. And so we have to make sure that we tighten them in a natural way. We have to make sure that we don't over tighten and cause certain issues. And then the other thing is you just really need to kind of look at the health of your overall health condition. Are you suitable for a facelift surgery? I do most of my facelifts under general anesthesia. I think it provides me the ability to fully anesthetize the face and have the patient completely asleep, so that we can really do the fat grafting like we want to, and do the lifting as we want to, and not having to worry about the anesthesia. That's my preferred approach. Okay, any more questions? Okay, well, again, we have a lot of educational stuff on the website. It's drjuleswalters.com. You can look through it under resources. We have several blogs, just a lot of educational material. We have a lot of before and after photos. Some of our facelift photos, we have more in the office. Some people don't give permission to utilize their photos. So, patient privacy is, 100% something that we take seriously. Everyone on the website is given our permission to showcase their results. So just, we'll be doing this for most days throughout the week, Monday through Friday. So again, if you guys have any topics you'd like me to cover, send me a DM, and we will see you tomorrow morning. Thanks for joining.